Well, that was a painful, incoherent waste of text. So speaking of pain, I just had a root canal. So let's talk about what that is, the physiology and the neuroscience behind the root canal. See, inside every tooth, we have this root that consists of living tissue, arteries that supply blood and nourishment to the tooth, and nerves that sense things like cold or heat or pain. And what can happen is, especially with teeth that are damaged, so in my case, I had old amalgam fillings. That should give you some idea of how old those fillings are because they don't do that at most dentists anymore. And the root started to get inflamed as a result. And what I started to notice was cold sensitivity in particular. That's usually the first sign for a lot of people. Now, remember, your teeth are supposed to sense cold, so just sensing it's not a problem. It's when it becomes painful. And even then, that doesn't necessarily mean that you need a root canal, because sometimes our teeth do get sensitive, but in those situations, it should go away pretty quickly. You remove the ice water and the tooth stops feeling painfully cold. Again, in this case, that wasn't what happened. Because that tissue became inflamed, that pressure being placed on the nerves causes them to become hypersensitive. We call that hyperalgesia, when parts of our body get oversensitive to pain. And then when you remove the cold water, for example, it continues to hurt, sometimes for many, many seconds, 30 seconds, 60 seconds, or even longer. Worse, I started to notice sensitivity to heat. That's less common for just a regular sensitive tooth and a worse sign. And because all of that tissue is inside a tooth, it's a lot harder to treat, even if, let's say, you had an infection. How do you get those antibiotics there, for example? And so in most cases, the solution, if it doesn't resolve, is what we call a root canal. And that's where a dentist goes in, trigger warning if you're a little queasy about this stuff, and literally removes that pulp. They drill into the tooth and they just dig it out. But I'll tell you, having had many root canals, unfortunately, due to some bad tooth genetics, they're surprisingly not painful procedures. They numb you up really well, and then they just drill away, and I usually just put some headphones in and kind of go half asleep until it's done. They just take a long time because the doctor needs to make sure they get all of that tissue out so we don't leave any remaining infected tissue, for example, if it's infected, in your tooth. Then they seal it up, and usually you have to crown the tooth because now, without all of that nourishment, the tooth can't sustain itself in the same way. And that's the root canal. Stay tuned for the next episode of Turning Stupid Troll Comments into Content.